Good evening to everyone. Today we are going to hello. Today going to have the discussion on the deficiency of the impact of nutritional deficiencies on cattle performance. That is the next topic is concerned, and an overview will have the nutritional deficiencies have significant impact on the cattle productivity and also the overall economics of the farming. There are the key features affected are nutritional deficiencies they reduce the productivity of the cattle and also increased susceptibility diseases. Then higher mortality rate is also another problematic. And fourth is the economic impact of the farmers in terms of the productivity goes down whenever there is a deficiency of the nutrients. So, what is the impact of the productivity? Is number one, meat production will be reduced because of the very poor carcass quality. And apart from this one, they also reduce the milk yield to the highest extent. And, and another thing is the animals will be having the lower production and the production ration, especially in case of the both the productive cattle and also the meat production is drastically reduced, which in turn causes the severe economic loss to the cattle owners. Then the health risks are also increased because whenever there is a deficiency of different amino acids, then also the proteins, then vitamins, etc., will lead to higher susceptibility of the cattle to the infection. Then the nutritional imbalance have greater effects on the calving interval also and also the growth of the calf. Then malnourished mothers lead to calves with very weak immunity, and hence all these animals need to be very well fed. That is the another thing which need to be given a great impact on the cattle. Then especially sometimes there is the risk of the cows born to the malnutrition mothers do always have the mortality risk. Then poor cholesterol quality and passive immunity is also problematic and lots of potential breeding stock. Then emotional and financial costs will also be there whenever such things are usually taken care. Then the economic consequences are also more. Usually, it is the huge economic losses will be there in the dairy cattle whenever such things are. Usually, it is more. Hence, always the cattle should be have proper weight, and at the same time sometimes there will be severe economic losses to the dairy industry whenever there is a threat to the life of the cattle with deficiency. Then also there is the long-term farm sustainability is also reduced. Then the strategic nutritional things need to be manufactured. Then here you can see that there is one disease known as subacute ruminal acidosis. So this is also going to cause lot of problem, especially in case of the cattle, because the cattle do require lot of minerals, vitamins, amino acids, proteins, lactose, and many more substances for very high quality milk productions. And here you can see that the nutrition distribution in the udder one fatty acid synthesis has to be taken place with the help of the acetyl CoA enzyme, a carbohydrate. Then also there should be the increased production of the different type of the proteins, or else sometimes it may lead to leukocytosis, then thrombocytosis, lipolysis, and also the cortisol level will be increased. Ultimately, it is going to lead to the laminitis and many more disorders which are happening, especially in case of the cattle. Then the common metabolic disorders, especially in case of the dairy cattle, because this is also another topic that need to be covered by us. So there is a small difference between the metabolic disorders versus nutritional disorders are concerned. So it is bit different metabolic disorders because nutritional disease long it's having the long term. For example, there the deficiency of the protein happens, and also the carbohydrate, minerals, etc., they will happen, but it can be corrected by supplementation of diet, but not fatal, especially the nutritional disorders or deficiencies, whereas the metabolic disorders are in acute stage and respond dramatically to the systemic administration of needed metabolites, and they will be potentially fatal. Then the disturbance of one or more metabolic process may be related to the regulation of certain metabolite in body fluids, and this affects the energy production or damages the tissue. So, some of these metabolic disorders are acquired, and it is very common because of the farmers' misfeeding of the animals, etc. So, the cascade of metabolic disorder occurs in a predictable fashion immediately after calving, or during the advanced pregnancy, or immediately after the dry period. Then the nutritional disorders are less dangerous to the animals when compared to the metabolic disorders, especially in transition phase, because usually 3 weeks before or after parturition, they will be having the metabolic disorders. Boys will have the metabolic disorders. So these 3 weeks before and after parturition can be divided into late lactation, then dry period, then parturition and early lactation. Or in the reverse order also we can show this thing. So the reverse order is also okay, no, not an issue, and we can see like the mid lactation, early lactation, late lactation, and also the dry period. So factors which predisposes an animal to metabolic disorders are always there is hormonal changes are involved, then abrupt change of the diet from one ration to the another ration is also involved. Then negative energy balance is another thing because of the low energy containing diets may also lead to negative energy balance. Then non-lactating to lactating stage. Suddenly, if they jump from non-lactating to lactation stage immediately after parturition, then lot of drainage of the minerals is always a problematic thing which leads to metabolic disorders. So, what are all the common metabolic disorders? Number one, the milk fever, two, ketosis, the gross tetany, then ruminal acidosis, or the Downer's-Coe syndrome is another important metabolic disorder, and fatty liver syndrome is also the important disorder. Then bloat, then retained placenta, laminitis, displaced abdomen. So these are some of the listed commonly occurring metabolites, whereas among these things, milk fever, ketosis, ruminal acidosis, Downer's-Coe syndrome, then RFM or retained fetal membrane are very common. Whereas the milk fever is one of the synonym of the parturient paresis, or else it's also called as the hypocalcemia or a febrile disorder. So there is no fever, especially in case of milk fever. No fever will be there, but simply it is misnomenclated as the milk fever. Hence, one need to know what is the exact reason of this thing. And of course, the hypocalcemia is a proper term to this particular disorder. Then here there is no fever at all, but it is a common disorders of the high yielders, especially the Jersey cattle and buffaloes. They are highly succumb to this milk fever. And heifers, of course, sometimes they rarely affected, and older cows increase in the susceptibility up to fifth or sixth calving is there. And risk of milk fever increased by approximately by 9% of the per cattle lactation. So, what is the etiology of this milk fever? It is a very commonly occurring disorder due to the hypocalcemia and due to sudden increase in the calcium requirement for the colostrum and milk production. Hence, this is a disorder in which sudden increase in calcium requirement immediately after parturition, and especially which is drained out in the colostrum, and also heavy production of the milk suddenly. So, what are all the predisposing factors for the milk fever are the increased estrogen level around parturition inhibits calcium metabolism. Increased estrogen level during the parturition always inhibits the calcium metabolism. Then older cows are unable to metabolize calcium from the bones, because the bones are the pools of the calcium, and the calcium of the body is deposited in the bone. And whenever there is a abrupt onset of the lactation, then the calcium should be poured out of the bones. But due to certain reasons, they are not released from the bone or the other places where they are stored as the depot. And feeding very high sodium and potassium containing diets also lead to metabolic alkalosis, which inhibit calcium absorption. Then, increased calcium intake during the dry period reduced the parathyroid activity, and hence the parathormone hormone is secreted very low quantity in the later stages of the pregnancy. Then low magnesium diets, example, the magnesium is very much necessary for the parathyroid secretion. Hence, the this is also another predisposing factor, but the exact reason why it is going to happen is not exactly understood. So, what is the characteristic clinical sign of the milk fever? Is the cows suddenly they take the recumbent stage and its head on the flank, as shown in this particular photo. Here you can see that the animal is in the sternal recumbency, then especially looking towards the abdomen. The face is looking towards the abdomen, and a very common disorder of this particular thing. And the body temperature will be very low, and sometimes the pulse rate, heart rate, everything becomes very, very low. The cow is morose, then the activity of the tail, then the pedal reflexes, then also the sunken eyeballs. All are the clinical signs of the sudden onset of the milk fever. Then the cows will be morosed in appearance, unable to get up or unable to walk also. And the farmer gets immediately the alarm that his cow is suffering from the characteristic milk fever. Then the preventive measures of this thing, how to prevent. And of course, we have got the treatment of calcium, etc. But feeding low calcium diet around calving increases parathyroid activity and synthesis of 125 dihydroxy cholesterol or the vitamin D3. So, in the last months of the pregnancy, high calcium containing diets should not be administered because the parathyroid activity will be suppressed and synthesis of vitamin D3 is reduced. Then sometimes feeding the acidifying rations or the rations which are containing very high maize quantity, and also the many times the feed which is overloaded with the grains, that also causes the low calcium level. Then oral drenching of the calcium around carving with calcium supplementation like calcium chloride will always cause the prevention of the this especially the milk fever. Then the vitamin D3 administration 2 to 8 days before calving will also prevent the milk fever. Then feeding low calcium diet around calving also, it's also a better thing, and feeding diet low in potassium. So during the last stage of the pregnancy and early lactation, the corn silage, then distillers grains, etc. should not be fed, especially in case of, yes, I got it. Sorry, brewer cyst. So, in case of the cattle, which are very high yielders, and many times the owners have got the habit of taking the brewer cyst and feeding it to the cattle, thinking that it's a uh, low cost solution for the cattle, but many times it lead to the sudden onset of the milk fever. Then the brewer's waste, always they are dangerous to the cattle. Then it should not be administered to the cattle to the highest extent, but adding something in the ration doesn't affect the uh, metabolic profile of the cattle, but chronic supply of this thing always reduces. For example, here you can see that higher sodium and potassium and decreases the or increases the chances of the milk fever, and higher sodium and potassium. So you can always suspect that such animals will succumb to the hypocalcemia. Then treatment is always, it is they recommended that calcium borogluconate at the rate of 300 to 600 ml of 40% solution, and it need to be administered always very slow IV, or we can also administer the subcutaneous injection for slow release to avoid relapse as well as to prevent heart block. So we should not administer the calcium very fast, because especially in case of the milk fever, there will be the decreased heart rate because of the decreased concentration of calcium in the blood. So there will be bradycardia, and hence suddenly if we administer the calcium little fast, it may happen in tachycardia. Then cardiac collapse may also happen. So that need to be taken care, and whenever administering the calcium borogluconate with magnesium sulfate, still the care has to be taken that it should be administered very slowly, so that the cardiac collapse should not happen. But sometimes the relapse always happen, and in complicated milk fever, composite solutions containing calcium, magnesium, phosphorus, and glucose, it is recommended. For example, the dairy cattle immediately after parturition, they are very prone to the almost all the metabolic disorders like the milk fever, the ketosis, etc. Then the lot of injections are also available in the market, like the calcium, and also administering the feeding the cows with the dicalcium phosphate continuously about 50 grams per day is also a better practice, or always better to administer the animals with the a good mineral mixture which is containing the properly balanced calcium and phosphorus is another measure. And apart from this one, sometimes the injection of the hydroxyprogesterone caprate. So we do not know the mechanism. Hydroxyprogesterone caproate 2 injection is always beneficial, especially in case of the milk fever and post complications of milk fever. The another important disease, metabolic disorder, is the bovine ketosis. Here, the ketone bodies are increased, whereas the glucose or VFA is totally decreased. Hence, this is a synonym of the acetonemia or cow fever or post-parturient dyspepsis in cows. Then another terminology is lambing sickness. Then two lamb disease also is another thing. Then especially pregnancy toxemia in case of Eve. So most of the metabolic disorders are done with misnomenclature like the toxemia. There is no toxicity at all here, but it is called as the pregnancy toxemia. But it's a very common name since ages and occurs in cattle and ewes in negative energy balance. Then very commonly characterized by elevated concentration of the ketone bodies, especially acetic acid, beta hydroxybutyrate, and acetyl in body tissues and fluid. Then another thing is decreased blood glucose level is also another characteristic feature of the bovine ketosis. So negative energy balance is always leading in the cattle to the formation of the ketone bodies like acetic acid, beta hydroxybutyric acid, and acetone in the body tissues and also in case of the fluid. And because of this thing, the decreased blood glucose from the routine blood glucose concentration will happen. Then suddenly onset. So what is the exact mechanism is insufficient feed intake causes the ketosis. That's the borderline or the underlying to it. So what is insufficient feed intake? So the cattle will have the feed intake, but it will lack the energy in terms of the maize, or if it is deficient in case of the ragi or any other thing which is rich in energy source. So what happens is insufficient ruminal production of the volatile fatty acids like propionic acid, a precursor of the glucose, take place. So what happens then later, whenever the glucose is not enough in the body, then the cow become hypoglycemic in nature, and there will be low blood sugar because the volatile fatty acids are converted to the glucose and later which are pushed from the bloodstream into the cells by the help of the insulin. Whereas the low blood sugar makes the cow metabolize fatty acids and glycerol supply. Low blood sugar. So the fatty acids in the body, they are utilized and glycerol suppliers. Then the glycerol suppliers. Then fatty acids and glycerol are oxidized to form the acetyl CoA glycerol. Fatty acid and glycerol are going to form the acetyl coenzyme A. Then excess of acetyl coenzyme A due to the lack of the energy, so it is converted to ketone bodies. Most of the time, lot of ketone bodies are there, and important ketone bodies are acetoacetic acid and beta hydroxybutyrate. Then this situation is called as the ketosis, and both of these things, acetoacetic acid and beta hydroxybutyrate, are called as the ketone bodies. So then these are the exact causes of the ketosis, because there is a lack of energy and liver cannot cope up with the increased demand of the glucose from the body. So if we administer a feed to the cattle, especially during the during the advanced pregnancy and after or just after parturition, then insufficient production of propionic acid, an important volatile fatty acid which is a precursor of the glucose, will be reduced. Then there will not be enough glucose, then the cow becomes hypoglycemic. Then the low blood glucose stimulates to metabolize the fatty acids in the body, because if the animal is having more and more fat in the body, and also it becomes the and another thing, the glycerol suppliers, then fatty acids and glycerol are converted to acetylcholine CoA. As acetylcholine CoA is going to be increased, then it is converted to acetoacetic acid, then beta hydroxybutyrate, and this is condition is called as the ketosis. Then the factors responsible for this disorder are the immediate early lactation and sudden demand of the energy, and also the increased lactation stress causes. Then maybe the excessive fatness around calving. During the calving or 1 or 2 months before the calving, then excessive fatness causes a severe ketosis, and we have seen this in case of the buffaloes. And cows suffering from milk fever will also succumb to the ketosis. Always ketosis and the milk fever are coming together. Then butyric acid content of the silate, if it is high, then also the milk fever will come. Then classical clinical signs of the ketosis are, if you go nearby the cow, we will get a sweetish chloroform like smell or acetone like smell, and also urine and breath, everything will be sweetish smell. And these other symptoms are reduced ruminal motility, decreased milk production, then abnormal licking and chewing. That's also called as the pica. So, the important clinical signs in most of the dairy cattle or the buffaloes immediately after parturition is selective feeding. So they start refusing the ration, but only will be on the roughage. So this once again leads more and more deficiency of the energy, because they are not going to consume the concentrates. And because they are not going to consume the concentrate, more and more propionic acid is needed to the animal, and there is lack quina of the glucose, and this is going to cause increased acetyl CoA. Then the propionic acid and beta hydroxybutyric acid are the two end products, and because of this thing, the reduced rumen motility, decreased milk production, and abnormal licking and chewing, and many times the CNS form of the ketosis is also noticed, and it is not an easy job whenever an animal succumb to ketosis. So it is very difficult to make them to come out of the ketosis. Even then, subclinical ketosis or the mastitis will be a common clinical signs in such animals. Then the prevention of this ketosis is preventing starving, and the animals should be fed very properly in proper time. Then also overfeeding should be avoided. And apart from this one, the niacin is given orally 6 to 8 gram per cow per day for 20 days prior to the calving, or up to 3 months of post parturition, and the animals should be administered with the niacin. That's always the better choice. And we should see that during the percussion, they should not accumulate more and more body fat. Then sodium propionate is another thing which we can administer about 100 grams for 6 weeks. 100 grams per day for 6 weeks daily in problematic herd. Or we if we have the already the history of some animals which are very prone to ketosis can also be fed with such ration. Then concentrate diet along with the good quality roughage is must. So, if the animals start eating, then we should not simply depend on the animal with concentrates. But very good quality roughage is very much required, or else the animals will enter up into the ruminal acidosis. So, the concentration diet with good quality roughage should always be given. Then the line of the treatment, there are many line of the treatment, and a single line of the treatment will not make the cow to come out of the ketosis concept. So usually the first line of the treatment is for all the cows which are suffering from the acute ketosis, 250 ml of propylene glycol can be administered with amount of the water orally per day. 2 to 250 or quarter liter of the propylene glycol can be added. Then sheep 120 grams sodium propionate in 250 ml water twice daily for 10 days. Sometimes the sheep will go for severe anorexia, then 12 gram of the niacin per day for 1 to 2 weeks is also another thing. Whereas the dexamethasone, a glucocorticoid, can be administered at the rate of 20 milligram total daily dose for 2 to 3 days followed by tapering decrease. But the disadvantage of the dexamethasone is it drastically reduces the milk which is produced by the animal because of its own effect on the animal, and drastic milk yield reduction will takes a lot of time to come to the animal to the original level of the production, and hence whenever we are administering the dexamethasone we need to be careful. Then apart from this one, many other treatments are also there. For example, the line of treatment of the ketosis is administration of hypertonic glucose solution. So we need to administer the animal with 20% glucose with 20 ml per kg and BID or once in day or twice in a day for 2 to 3 days. Then that's also the better line of the treatment. And sometimes the B complex vitamins are also essential. Vitamin B1, B6 and B12 and the phosphorus supplementation will also a better choice. Then many times the isopropradone is also administered, but sometimes it itself may cause the sodium and potassium imbalance. Then triamcinolone acetate can also be administered to the bovine ketosis cattle with good result, but at the same time it is uh, having very potent hypo milk production means the milk yield will be suddenly decreased. Hence, one need to be little bit careful and administration of the glycerol to the animal or glycerine. Same dose 250 ml with equal quantity of the water per day for 2 to 3 days continuously has to be slowly drenched to the animals. And sometimes whenever the animal is too much reluctant to respond, then after administration of the glucose slow IV about 2 to 3 bottles of 500 ml of 20% solution, then about 200 units of the insulin can also be administered by subcutaneous route to the animal, and many times this is very effective in case of the buffaloes. So it is very difficult to treat the buffaloes once they enter the bovine ptosis. Hence, it's a very challenging disorder, and always we need to go for the preventive measures. Then lactation tetany is also known as the grass tetany or grass staggers or hypomagnesiamic tetany, or another thing is the winter tetany or wheat pasture poisoning. So remember all these things, they may definitely come in case of the multiple choice questions. And etiology of this thing is low plasma magnesium levels, often accompanied by the hypoproteinemia, calcinemia. Symptoms: muscular spasms, loss of consciousness, and ultimately death may happen suddenly if it is not properly treated in a proper time. Then prevention is magnesium oxide should be mixed with salt in ratio of 75 to 25%. Feed then ad libitum. Then salt licks mixed with 10 parts of magnesium sulfate and calcium diphosphorus is mixed with 80 parts of the salt to be provided. And fertilizers very high in sodium and potassium should always be avoided, either they will cause toxicity or cause more and more aggravated condition. Then treatment of the hypomagnesiamic tetany is 2%, 200 ml of 50% solution of the Epsom salt or the magnesium sulfate, or many times the calcium magnesium borogluconate is also a better choice, but it has to be administered once again very slowly. Animals should be removed from affected pasture and fed 50 to 60 grams of magnesium oxide, because the magnesium sulfate is not well absorbed into the intestine and cannot supplement the magnesium in independent or the sufficient quantity. In case of cows, subcutaneous 10 milligram MBSF4 plus sterile water, followed by oral administration of 10 to 15 grams of magnesium oxide. So, and always the animal should be avoided with sudden green powder, which will lead to the hypomagnesiamic tetany. Then another thing is the ruminal acidosis. It's a very common syndrome where with the rumen pH is reduced from 6.8 to 5.6 to 5.1, whereas it may be lactic acidosis also, because it's also known as the grain overload or grain poisoning. Then acute indigestion, or maybe due to increased amount of the production of the volatile fatty acids. So this is also another situation. Sometimes the accidental ingestion of the rice or any rich carbohydrate containing easily digestible carbohydrates, if they are suddenly taken inside in more quantities. For example, the wastes of the kitchen just during the marriage, etc., are always fed to the cattle. Then it is divided into acute or acute ruminal acidosis, wherein the ruminal pH will be 5.2, whereas the subacute ruminal ketosis, the pH will be of the rumen will be 5.5 to 5.1, whereas in case of chronic acidosis, that is pH is 5.6. So this is also called as SARA, means subacute ruminal acidosis, SARA. So this is not associated with lactic acidosis. That's the totally different from that of the SARA. Then etiology: ingestion of the unaccustomed feed suddenly are very rich in ruminally fermentable carbohydrate. Best example is sudden administration of the rice gruel, rice, and sometimes the crushed maize suddenly. Then also sometimes different types of the grains, and sometimes the fruit wastes, especially the jackfruit and mango fruit wastes. If they are administered to the cattle suddenly, then they will succumb to ruminal acidosis. Then it's a cyclic uh, thing, then rapidly fermentable carbohydrate like the rice, etc., starch, they are all administered to the cattle. Then lot of volatile fatty acids are suddenly exploded in the body. Then it is going to increase the bacterial growth in the rumen, because to utilize more and more incoming VFAs, then bacterial growth initially it increases, whereas later drastically the rumen pH decreases from 7.4 to 5.5, etc. Then the increased production of lactate will be there in the body. Then the pH of the rumen is going to be decreased up to 5.8 in the pH range. Then that situation where in which this yellow band is there, that can be the area where subclinical ketosis is also there. Then because of this pH has reduced to 5.8, bacterial growth rates have drastically reduced. Then decrease with the enzyme activities of the fibrolytic microorganisms. Then increased lactate production, the pH will be reduced from 5.8 to 5.5. Drastic reduction in the pH because of more and more the lactic acid formation. Then apart from this one, we can see that the drastically the pH is coming down from the 7.4 to 5.8, then still it is going to decrease. But in this stage, it is called as the acute ruminal acidosis, where the pH drastically reduces and sometimes the it may also become a cause of the death of the cattle. Then, apart from this one, the S bovis content will be drastically reduced. Then, D-lactate production, etc., they will be more. Then, prevention of the acidosis is proper balancing of the fiber and non-fiber carbohydrate ration, and it should not be fed in separate components. Always the properly very well balanced ration is very much required to the animal, and during the advanced pregnancy they should not be overfed, so that more and more fat should not be accumulated in the body. Then the fermentable feed, if it is available cheaply, better to restrict it always. Then including long fiber particle in diet increases salivation. Then additional dietary buffers like the sodium bicarbonate can also be continuously it can be administered, especially in case of rumen acidosis. Then apart from this one, the supplementing the microbial load in the form of the rumen curd, then the megaspera, alcedinae, and selenomonas, this ruminant. So these cultures which are having such container has to be administered with the this thing. Then apart from this one, inophores. Then the example is monensin supplementation will prevent the ketosis, but at the same time, one need to be very careful about the dosage. So it may lead to the for antibiotics, they may lead to toxicity of the inophores, or drug resistance also may also happen. Then treatment of the lactic acidosis is, then what are all the clinical signs? Suddenly the animal goes into the inappetent stage or anorexia stage, then drastic reduction in rumination happens, then reduction in the buffering capacity of the saliva. In case of cattle, more than 100 liters of the saliva are produced per day. and they are going to survive it, and they use it as the buffering solution without depending upon any other person. Whereas the antibiotics like penicillin, tylosin, etc. are administered to reduce the risk of liver obsession or the fatty liver syndrome. So always it will be a better practice to drench the magnesium hydroxide, sodium bicarbonate, and sodium bicarbonate injection is also many times useful in recovering the animals which are suffering from hypomagnesiemic tetany and also the milk fever. Then this is also another one of the most problematic thing. A Downers cow syndrome, or short form it can be called as the DCS. So this is a secondary recumbency developed from the pressure damage to muscle and nerves, then often preceded by the milk fever. Then etiology of DCS is not known and multiple factors are involved. Suppose if the animal goes to the ketosis stage, then uh, the chances of recovery are uh, there, but it takes long time, and more precious drugs need to be administered to the animal, as even I am not there in the thing also. The Downers cow syndrome can be alert or non-alert. So etiology is totally metabolic, hypocalcemia, hypophosphatemia, hypomagnesemia, then hypokalemia is one of the factor that predisposes the cattle to the ketosis. Then the characteristic clinical signs of this disease are sternal recumbency is a very common thing. Then sometimes body is stretched out behind, or frog sitting position is also another possibility, and four limbs function, that's called as the creeper's cow syndrome. So you may not have seen such animals, because the creeper cows, once again, they are unproductive and become the more and more susceptible to the all the metabolic disorders. Then prevention of this is milk fever should be adopted wherever the especially the reduction in the calcium, potassium, calcium, etc. may also be helpful. Then they should be comfortable bedding with prior to calving and should be provided. Sand is ideal bedding to the animal, and immediately if it is having Downers cow syndrome, better to lift it as on the same day, because one has to think that this is going to be, if it is coming to the secondary metabolite, then that's also a problem happens. Treatment, calcium therapy should be given, additional dicalcium phosphate can also be used. Then potassium, phosphorus, and magnesium should be given always along with the diet. And nowadays, many companies are also preparing the cattle container and claim that it doesn't contain the calcium. But we need the calcium. At the same time, they should be not advised to sudden administration of calcium for the benefit of their company name. Then the another disorder is FLD, or fatty liver diseases. Then synonym fat cow syndrome, hepatic lipidosis, or the etiology is due to the negative energy balance, non-esterified fatty acids, or NIFA. This is going to be mobilizing from fat stores and implementation of triggering the triglyceride in the liver, leading to the fatty liver. And cows that are over conditioned as calving, if the body's condition is 2, it should not go to 3.5. Then here you can see the milk, this fatty liver syndrome. Triacylglycerol is converted inside the adipose tissue to form fatty acid plus glycerol. Then the team went to the acidosis, whereas negative feedback mechanism is also sometimes the deficiency of the hormones, sudden change in the hormone pattern to, to reduce the enthusiasm may also be expressed. So here we can see one need to tag the triacylglycerol or glycerin, etc. Then it should be drenched about 35 to 65 ml. Yes, of course. The prevention body's condition score of the animal should be 2.5 to 3 should be maintained throughout the calving, or else it is succumbing to the negative energy balance. Then the treatment of this condition is IV administration of 500 ml of sodium or solution of the glucose slash the dextrose, which may be combined with the oral administration of 250 ml of the propylene glycol. Then the cow around the parvitization will be susceptible to so many diseases. Number one, drainage of the minerals in the colostrum causes milk fever, grass tetany, and DCS. Whereas the cow around parturition will always have the negative energy balance that lead to ketosis and also the fatty liver syndrome. Then both of these are simultaneously they will come, and this shift to concentrate rich diet suddenly shifting. Then another reason how the cows are going to become the runners is the feeding of the fiber contents low. Then laminitis is another metabolic disorder. It's found in sinker. It's also known as the founder or sinker, and it's a primary disorder of the equine. But later, it is also known for the productivity side of the cattle. Then this may be caused due to excessive intake of the very high rich or the carbohydrate content like starch, high grain diet, and also the obesity. Then leads to lameness, loss of athletic performance, then claw deportment is such as slipper foot. Then balanced diet is always better in case of the laminitis which are low in starch content and adequate fibers should be fed. Purpureal hypocalcemia is another syndrome or purpureal tetany or grass tetany. Then sometimes in dogs it is referred as eclampsia. And another thing is the pure peral, this peripheral hypocalcemia will also be there. Then clinical findings will be very much similar to that of the partial of feed 1 or 2 days, then they are going to consume more and more protein. Then now it is the term of nutritional disorders caused by the vitamins or deficiencies of the vitamins, and also deficiency of micro and macronutrients. So the vitamin A is one of the important thing that is very much required for the maintenance, then growth, then reproduction of the animal. Reproduction, then production. So if no vitamin A, animal will stop growing and may die also. So deficiency disorders are always classified into the eye problems, then eyes problems will include continuous water or the lacrimation, then sometimes the night blindness, then class T material in nostrils and eyelids. The second one is the reduced egg production, especially in case of the birds. Then vitamin D is very much required for the bone formation and the carbohydrate metabolism, then absorption of calcium and phosphorus from the small intestine. But once again, for this, the cattle has to consume a lot with sufficient quantity of the balanced thing. Nutritive value is especially in case of birds, then it causes different type of the disorders. Uh, then curl toe paralysis, etc. They are all going to be caused. Then soft eggshell will be the cause of the low vitamin D. Then rickets is another cause. Osteomalacia means softening up of the bones due to the deficiency of the vitamin D and calcium is also another source. And hypocalcemia is the source. Of course, the poultry, etc., somebody need to do the research and will try. So, endochondrial ossification defects will be there in case of the animals which are subjected to the deficiency of the vitamin D. Then important signs of the vitamin deficiency include slow or poor growth, then poor reproductive performance, then decreased production of meat or egg if you go towards that side. Then anorexia may be complete anorexia, then edema of the brisket may also happen. Then skin feather problems of are also noticed in case of the birds. Then totally there will be decreased in appetite and some animals will show the diarrhea. And once diarrhea is caused during the meeting, etc., then it will be completed in train. Then vitamin E is another important what this fat soluble vitamin. Then importance and deficiency of this causes the smooth muscle structures and also the reproductive organs do also have the smooth structure. And what happen if vitamin E or hypomagnesemia is caused? Then the reproduction is being affected, then muscle structures are also going to be added more and more. Then encephaloplasia, or it's also called as crazy chick disease, especially in case of bold serial softening up of the brain, ataxia, disqualification. Then neuromuscular defect is also the characteristic feature of some disorders. Sulfur and the amino acids are always needed. because muscular dystrophy starts occurring in case of the larger animals like cattle or sometimes the sheep also. Then sometimes we say that there is a lack of vitamin B12. It has yielded the some of the money etc. for conducting few more research as I have convinced them. Then vitamin K is important for blood clotting. Number one, everybody has washing the face 2 or 3 times to become more and more handsome. Zero two, the activation of prothrombin to create calcium binding sites. Then this deficiency of the protein will not much difference that we put to the Google Meet. Then hemorrhages in severe cases, then severely they are deficient of this, especially those who are win as the consolation prize may also be given. Then the vitamin B complex or thiamine importance, it's also the carbohydrate metabolism outsource. What happens is if it is not properly given, polyneuritis means all the joints will have no problem and wherever the nerve endings are reaching, everywhere in the body it is there. And sudden administration of carbohydrate will always cause the vitamin B1 deficiency and some or somebody has to this insert it. Then vitamin B2, riboflavin importance and deficiency, carbohydrate and protein metabolism is there, and most likely to be deficiency in swine and poultry. Then deficiency causes decreased growth rate, low feed efficacy, crude curled toe paralysis will happen if vitamin B12 deficiency happen. Then niacin is another thing. It is very important in energy metabolism, enhance protein synthesis, and the deficiency of this one will lead to dermatitis. Niacin, poor feathering, especially in case of cows, this poultry. Then black tongue is there, but in case of cattle. Then beeswax or pyridoxine will also be happening to reduced in quality and quantity. Then proteins of metabolism, RBC formulations, and the deficiencies, and also the RFM, retained lattice central membrane. Then also they may go to the dermatitis, encephalitis like low type of the convulsions, anemia, and partial alopecia will also be there. Then pantothenic acid importance is metabolic role in vitamin A. Then it is do having lot of poor feathers. Then suddenly they will develop conjunctivitis. Then subcutaneous hemorrhages and severe edema may also happen. So metabolic role in forming the vitamin A is the deficiency of some pattern like 20% concentration has been reduced and poor feeding with the naturally grazing thing may come back the situation and as of now nothing is being done by any one of them. Then biotin importance, carbohydrate and fat metabolism, then poor growth, then dermatitis, especially in case of the cracks in high producing the cattle, maybe the Jersey or HF. Then hair loss is also another thing. Folic acid is also known as it is very much required for the synthesis of the precursor of the hemoglobin. Then hemoglobin is converted as the his own partner secretary. Then it is leading to vitamin B12 deficiency. So a person who is taking the folic acid, he should always watch what are all the others drugs either I am taking orally or parenterally. Then diseases are almost same at biotin, reduced growth of the poor feathering, etc. Then vitamin B12 synthesis of the hemoglobin along with the folic acid will take place, that causes nervous disorder and poor feathering and leg weakness. So vitamin C is one of the better diet to this animal, these birds, and so we need to study for supplementation of the such things. Thank you, especially. Then many times the micro and macronutrient deficiencies may also happen. Then the disorders of mineral metabolism or deficiency is also in that thing. So the minerals are naturally occurring substances. They are all inorganic in nature, but a definite composition and internal structure. Until 1150, about 30% of the mineral of absorption. So major elements are calcium, phosphorus, potassium, sodium, etc. Then micro or macro trace minerals. In 1970, the selenium, chromium, fluoride, etc. are done. Then let us see very fastly. The minerals are very much required for the different body activities like the perfectly arranged in a regular manner means that they are crystalline, or if it is not so, then it is amorphous solution or liquid. So the minerals deficiency will happen naturally, then inorganic the way. Then third one is the solid, which is always required. Then supply of the mineral is one of the tough task, but nowadays it has become a routine. And leguminous are richer in major minerals and contain some quantity of the calcium which may not be sufficient to the cattle to cope up with both the body maintenance and also the pregnancy and sometimes all these things. Then animal utilize source of the plant of from direct supply after processing modern days, that is mineral mixtures. This is the way how the minerals are absorbed into the circulation. For example, the absorption of minerals is taking place here. Then, of course, the digestion of in the GI tract will cause bulk of the cereals in SI absorbed to epithelial cells. Then, because of this thing, decreased blood streamage, the stream which is already suspected so many months back itself. Whereas, ultimately, low quality blood flows, then sometimes the tissues may also get damaged. Then, what are all the required this uh, minerals? Is number one calcium, number two phosphorus, whereas the third one is sodium supplementation. 1% should be always there. Then magnesium cofactors for metabolic enzymes is also another thing. Then potassium, it's also regulated heart rate and the membrane potential. Zinc is one of the trace mineral, ferrum, copper, and sulfur. You should come with the documents. Mineral metabolism, if there is a drastic reduction in the calcium, so that may lead to the milk fever. If it is underfed also, you will not be so happy. So in the skeleton and bone, 99% is totally is calcium pregnant and can also be essential component of the or the dairy cattle maintenance. Bone marrow ash need to be put as 30 grams low IV. Then sometimes the animal may respond, or it is very difficult once the animal goes into the Downers syndrome. So, lot of metabolic pathways are increased, like the IV fluid of sufficient quantity, maybe 1 or 2 liters. But I am not surprised that this will happen in case of the dairy sector also. So what happens if the calcium deficiency, if it is happening in a cattle shed, then the young plants or older plants are required. Phosphorus should be the content of the feed to the extent of 80 to 85% in bone, and the other thing is in case of the HQA. Then disorders, sodium deficiency, effect of osteomalacia, then deficiency diet, then animal growth factor, growth is another issue, then they will not grow. Then abnormal, unacceptable, constable, or the beggar, we should not complain the anniversary. Potassium is another thing. Of course, the potassium deficiency is just you go through these slides. Excess also causes the toxicity. Then sodium excess, chlorine excess, and sulfur. So the number one is essential in small amount, but excess sulfur should always be purchased. Then magnesium, if it need to be increased drastically, then we need to go for the wood lye. Anemia due to reduction of the hemoglobin, increased nervous irritability. Then copper, it is anemia, poor growth, but this is a time frame drug. We need to have it. Finally, we have reached the conclusion the vitamin deficiency can be both mild and already affect. It always a better option to incorporate routine, healthy eating regimen to avoid all these things. Then, among all the key vitamins that play some role of the well-being are vitamin B complex, all the three. Then also the vitamin D is very crucial. So one need to make this sure that enough of them took for the supplements. So finally, the conclusive remarks are nutrition deficiencies in cattle affect productivity, reproductivity, health, then sometimes the mortality and also severe loss of the economy. Then addressing the deficiencies is crucial for sustainable, profitable farming. Then proactive nutrition management ensures the better herd health and financial stability. Yes, thank you very much for a long standing class. Thanks a lot. Have a good break on the Sundays, and I will try to share some of the question papers as and when it is required. Goodbye now.